Welcome to today's presentation titled Marijuana Use in Teens, Shifting Through the Weeds. This webinar series is made possible by a grant award from SAMHSA, the Substance Abuse and Mental Health Services Administration. We are excited to provide this virtual series during the month of September, which is National Recovery Month. Today's session is being recorded and will be uploaded to the CMH YouTube channel for future reference. Please feel free to use the chat box to ask questions and add comments you have at any time during the webinar. And if time allows, we'll do our best to answer as many as we can at the end of the presentation. Our presenter today is Dr. Anju Swany. Dr. Swany is a pediatrician and director of adolescent medicine at Hurley Children's Hospital, Hurley Medical Center in Flint, Michigan, and an associate professor of pediatrics with the Department of Pediatrics and Human Development at Michigan State University, College of Human Medicine in Lansing, Michigan. And with that, I will hand it over to Dr. Swany.
Good evening. Thank you, Sarah, for that kind introduction. And it's my pleasure to be a speaker here at the St. Clair County Community Mental Health Recovery Summit, the virtual series. I really want to express my gratitude to Dr. Annette Mercante for inviting me here today to talk about marijuana use in teens. It's a huge topic. I'm going to cover an awful lot of information in the 1 hour that we have because there's just a lot to talk about. It's a very new area and a lot of research going on. So just in terms of, overall adolescent substance use, it's a complex phenomena. There's definitely increasing information that addiction is a central nervous system disease, and with specific structural functional changes within the brain that are both genetically determined, but also triggered by particular substances. And the unique part of substance use among adolescents is the fact that the adolescent brain is still growing and developing. And also the period of adolescence is really a unique period in that part of normal adolescent development is experimentation, and sometimes experimentation with high-risk behaviors such as drug, sex, and rock and roll, as we call it. So although adolescent substance use is certainly not normative, it certainly is prevalent in terms of at least the experimental state. And often adolescents, drug use is sort of co-occurring. So adolescents may start off with smoking cigarettes or these days vaping, and then those same adolescents will then experiment with alcohol use and then maybe go on to experiment with other illicit substance use, in particular marijuana. Unfortunately, adolescents who start with substance use earlier in life also have a higher degree of dependency on these substances as adults. And any substances impact normal adolescent development and also impact their academic achievement in a negative way. Alcohol and marijuana are really the most common illicit substances used worldwide among teens. I mean, partly alcohol because it's easily available, and now as marijuana becomes legalized in the United States and actually gradually many more countries such as Canada, certainly that's also going to be more sort of accessible to teens as well. So just want to start off a little bit to talk about what are the current trends with respect to drug use among teens. And these are results from a survey called Monitoring the Future survey, which is an annual survey given to 8th, 10th, and 12th graders, conducted by researchers through social research at the University of Michigan Ann Arbor in conjunction with the National Institute on Drug Abuse, which is part of the NIH Department of Health. So they give a survey to over 40,000 students in the 8th, 10th, and 12th grade every 2 years to really sort of assess and follow the trends of drug use. So I'm going to kind of go over the current results of this recent survey. And these current results are from the 2019 survey in terms of drug use among teens. And again, I'm not going to go through all of them, but particularly highlight mostly marijuana use and what the trends are. So as mentioned, and looking at this illicit drug use among 8th, 10th, and 12th graders, marijuana is the most common illicit drug used in the United States by teens, as well as by adults, as we could see here. Past year illicit drug use lists marijuana as the most common illicit drug use. In terms of just going back, because we mentioned both alcohol and marijuana are the two most common illicit substances used by teens. What are the current trends in 2019 with respect to past year of alcohol use among adolescents? And as you look at this slide, you can see that the green bar represents the 8th graders, the yellow bar, the 10th graders, and the blue bar, the 12th graders. So past year of alcohol, the good news is over the past 10 years, from 2009 to 2019, there has been a significant decline in the use of alcohol across all grades. So in 2019, about 20% of 8th graders said that they've used alcohol in the past year. And about 38% of the 10th graders said that they had tried alcohol in the past year. And about 52% of the 12th graders had said that they had tried alcohol in the past year. But as I mentioned, the good news is that alcohol use is down in terms of usage among teens. Classically, if adolescents are going to use alcohol, they tend to sort of do what we call binge drinking, drinking on weekends and holidays. So again, binge drinking of alcohol has also declined over the past 10 years among teens. Currently, maybe 4% of the 8th graders report that they're binge drinking, about 8.5% of the 10th graders, and about 14% of the 12th graders. So in terms of marijuana, which is what we're going to focus on today, what are the current trends in terms of marijuana use among the, again, 8th, 10th, and 12th graders in 2019? So unfortunately, the trends here show that marijuana use is steadily on the increase, and in fact, quite a sharp rise in increase in use of marijuana from just 2018 to even 2019. So as you can see, daily marijuana use among the 8th grader is about 1%, 1.3%. Daily use of marijuana is about 5% among 10th graders, and daily use of marijuana is about 6.5% among 12th graders. But in terms of past use of marijuana, again, that's also increased in 2019, and about 12% of the 8th graders report that they've been using marijuana in the past year. About 29% of the 10th graders said that they've used marijuana in the past year, and almost 36% of the 12th graders stated that they had used some marijuana product in the past year. So significant increase in marijuana use. The other sort of trend that we're also seeing is also increase in vaping of marijuana. So, many of us are familiar with increase in general in terms of e-cigarettes and what we call vaping of nicotine products, or products in these e-cigarettes that are sort of flavorings, but often these flavorings products may be laced with nicotine, and they use the e-cartridge or e-cigarettes, which are electronic sort of versions of the cigarettes, to smoke these flavorings or nicotine, and now are using these e-cigarettes to also smoke marijuana. So vaping of marijuana has gone up significantly as well. And this past year was the first time in 2019 that they actually added this question with respect to vaping marijuana, because it's sort of a more newer trend, or at least we're sort of assessing it. So again, as we see that about 4% of the 8th graders reported that they vaped marijuana, about 13% of the 10th graders, and about 14% of the 12th graders said that they had used e-cigarettes and vaped marijuana. Daily vaping is also certainly about less than 1% among the 8th graders, maybe 3% about the 10th graders, and 3.5% among the 12th graders. So while many kids and many people think that vaping is maybe less harmful, or why do teens choose to vape marijuana versus smoking it in the regular joint, or rolled in a cigarette, part of that may be because they feel that if they're vaping, just like cigarettes and nicotine, there might be less smell. As we know, marijuana has sort of a very unique smell, a sort of earthy kind of a smell. So vaping it decreases some of the odor. Also, what you do in the cartridges is put sort of the liquid form of the marijuana, concentrated marijuana form. So when you're vaping it, you're actually also inhaling a much more potent form of marijuana. So let's go back a little bit and talk about what is marijuana, or the technical term would be cannabis plant. So for our lecture here, I'm just going to focus on calling it marijuana. And a lot of us are familiar with the terminology. They're also known as like blunts and boom, buds, ganja, grass, hash. joint, pot, reefer, weed, all kinds of terminology out there for marijuana products. And really what marijuana is, the dried leaves and the flowers of the cannabis plant species. And the cannabis plant species has many, many subspecies within it. Classically, cannabis sativa and cannabis indica are the two plants that have high concentration of THC. And there's more than 300 different chemicals in these cannabis plants, much of many which we haven't identified yet. But one of the key components are what's called THC, or delta-9 tetrahydrocannabinol. THC is the chemical that is responsible for a lot of the drugs, sort of what we call psychotropic or mind-altering, or sort of the psychological effect of the high of marijuana. So that's really the THC component, the delta-9 tetrahydrocannabinol, that causes the high of the marijuana. But as mentioned, there's many different species of the cannabis plants, and over 60 different known what we call cannabinoids also are the chemical found in the marijuana plant. And many of you have heard of sort of CBD, or what's called cannabidiol. That's also CBD is also cannabidiol is also a chemical found in the marijuana plant, along with the delta-9 tetrahydrocannabinol, which is the THC part. So I'm obviously going to not talk about CBD oil, because that's another hot topic and a discussion in itself, but really focus on the true marijuana and the THC component. So THC, the delta-9 tetrahydrocannabinol, is the active ingredient that causes the high. It's metabolized in the liver, and then also converted into a non-active metabolite. And it's that non-active metabolite of THC that's excreted in the urine. So when we do a urine drug screen and we get a positive for THC, it's the non-active part of the delta-9 tetrahydrocannabinol chemical that is found in the urine. And as many of you may be familiar, urine drug screens may not be as useful because the non-active metabolite can be found in the urine 3 to 5 days after just a single use of marijuana, or for several weeks to months in terms of chronic users of marijuana. So it may or may not be very helpful in monitoring use. I do want to talk a little bit about the fact that over the past, since probably years now, the amount of THC found in the marijuana species has increased over decades. You could look at this graph here and see that the blue line indicates the amount of marijuana or THC in the marijuana plant. So, the psychotropic component has continued to rise exponentially, whereas the amount of what we call CBD, the other chemicals, the cannabidiol, are decreasing. So in other words, if we look at a marijuana species from the early 1990s to early 2000, and compare the THC content of the marijuana plant, there is much more THC in the marijuana plant now, about 15% higher than was 20 years ago. So in other words, we are cultivating a lot more stronger marijuana plants with higher level of tetrahydrocannabinol, which can be quite disturbing because we know that that's the active ingredient that causes psychotropic and psychological effects. So in other words, weed is just getting more potent these days. And now that we're able to cultivate it, and with legalization, have marijuana plant, you can really individually grow different species of the marijuana plant and kind of control and create hybrid plants and control the amount of THC versus CBD in the plant. And so these marijuana plants are getting stronger in terms of the THC component, and that can definitely lead to a lot more detrimental effects of the THC. So just looking a little bit about the shift in sort of the cannabis landscape or the marijuana landscape in USA as we move to many states move towards legalizing marijuana, we're seeing that, the landscape is becoming a bit more green, as I call it, the same color as the marijuana plant. But this is the current sort of map of marijuana legality by state. This is the sort of the latest data as of June 2021. And as seen here, the cannabis landscape in the US is definitely getting more green. So the states that are Dark green are the states where both recreational and medical marijuana is legalized. The other sort of a little bit less darker green is the states where medical marijuana is legalized, but other recreational marijuana is sort of decriminalized. Then the sort of a little bit lighter area again of the green states are the states where only medical marijuana is legalized, recreational marijuana is not. And then we move on to sort of these other lighter green states where neither medical nor recreational marijuana is legalized. Marijuana is just decriminalized. Excuse me. And then the gray ones are, excuse me 1 second. I apologize. The gray ones are the states that CBD is legalized. And the orange states are the states where marijuana, both medically and recreationally, is completely illegal. So again, as of 2021, what is the legal status of marijuana in the United States? So 48 out of the 50 states, including the District of Columbia, have passed laws that permit the use of marijuana for medical purposes. In Michigan, medical marijuana was legalized in 2008. Currently, again, as of 2021, 18 states, including Michigan, have fully legalized both medical and recreational marijuana use. And 31 out of the 50 states have undergone some sort of decriminalization of the marijuana laws. So nonetheless, we are definitely moving towards legalizing marijuana for both medicinal and recreational purposes all over the United States. But nonetheless, marijuana possession, sale, and use still remains illegal in terms of the federal law. So, you know, making kind of marijuana an ambiguous, the status of marijuana ambiguous, because federally it's still illegal, but each state now regulates marijuana use depending on what the laws are in the states, and these laws are changing. So as mentioned, in the state of Michigan, as of December 6th, 2018, it was recreational marijuana was already was legalized, medical marijuana was already legal, and it was legal to grow and use marijuana in the state of Michigan. And I'll talk a little bit about the specific parts of the law a little bit later. So as mentioned, the Department of Justice and the Attorney General said that the Federal Controlled Substance Act says that marijuana is still a Schedule I drug, meaning that there's no currently accepted medical use. So at the federal level, it's still a Schedule I drug. Under the Obama administration, the US Department of Justice had agreed not to sort of enforce the marijuana laws in states that had legalized it, but had a robust regulatory scheme for medical marijuana. But this policy was reversed in the Trump administration in 2018. So on that note, as we are moving towards legalizing recreational marijuana in more and more states, the question comes, does legalization of marijuana encourage use among adolescents? And that's really a very important question, a very good question when we're talking about substance use among teens, because obviously we know substances such as tobacco and alcohol that might be sort of legalized and are more easily accessible among teens, and therefore make the assumption that we're going to see an increase in use of these substances because it's just easily available. So is that happening with marijuana? And, you know, the data out there in terms of the question that does legalization of marijuana encourage use among teens is really kind of mixed. Part of it is I think we just don't have enough data yet because it's just been more recent years of legalization in terms of recreational marijuana. But there's some studies, you know, 2018 meta-analysis conducted some studies that didn't necessarily support the hypothesis that legalization of both medical and recreational marijuana. Well, it didn't support the hypothesis that legalization of medical marijuana increased use of marijuana among teens. In recreational marijuana law and increased use of marijuana was kind of mixed bag. And for example, they did the data from Monitoring the Future survey in Washington State said that legalization of recreational use of marijuana did not find any increase in use of marijuana in the state of Washington, but in the state of Colorado, it did. So again, there's a lot of mixed review. And that might be that legalizing recreational marijuana may not necessarily mean that there's increasing use. And part of that fact might be explained that now by legalization and more tighter regulations, it might be more difficult for teens to obtain marijuana. Previously, it was through drug dealers, and they were willing to sell it to anybody and anywhere. Now with legalization, there's tighter licensing and requiring proof of age. The legal age of marijuana in all the states is 21, like it is in alcohol. So therefore, it may be tougher for them to get it. But again, the jury's still sort of out on that part, and I think we'll see more data coming in. So with legalization of marijuana, the other question is also, how do teens perceive marijuana? Do they perceive it as something to be worried about, or something that they shouldn't be using? What's their perception? And again, there's a few studies done that shows even before legalization of marijuana in terms of recreational use, there was a decline in perception of marijuana being harmful. So teens' perception of marijuana in terms of it being harmful has declined over the years and continues to decline. And part of that might explain increase in use because they're really not viewing it as a harmful substance. And that's a lot of that is also due to the mixed messages that adolescents are getting out there, particularly again with legalization, both for medical marijuana and recreational marijuana, that, hey, it's okay, it's safe, which is what teens think. So therefore, we might be seeing that dramatic increase in marijuana as a result of that. There was another really good study done, Youth Risk Behavior Survey in 2014 in Washington, looking at use of marijuana among youth in Washington. And this survey looked at the relationship between marijuana use and perceived parental and community norms. So among 10th graders. So kids who believed that their parents thought that it was wrong for them to use marijuana, only 13% of those kids use marijuana. On the other hand, kids who believed that their parents thought that it was not wrong to use marijuana, 59% of those kids use marijuana. And what about the community norm? So kids who believed that the community norm in their community was that it was wrong for them to use marijuana, only 16% of those kids use marijuana. Whereas kids who believed that in communities that it was not wrong to use marijuana, 32% of those teens use marijuana. So again, a perception and what's the norm in their community definitely influences adolescent marijuana use. So the AAP came out with a statement in 2015, and now most recently, there's some wonderful articles written in the Pediatrics in Review with respect to marijuana use. Just the February 2020 Pediatric in Review article had a very nice, Pediatric in Review journal had a very nice article on marijuana use among kids. Highly recommend reading that. But generally, the AAP opposes legalization of marijuana because of the potential negative harms to children and adolescents. It advocates for decriminalization of marijuana. And decriminalization means reduced penalties for use and possession of marijuana to a misdemeanor, a civil offense rather than a criminal offense. And where in states where marijuana is legalized for medicinal or recreational purposes, there should be very tight regulations in terms of dispensing marijuana to anybody who's younger than 21 years of age. And AAP discourages use of marijuana by adults if they're around kids as well. So on that hand, AAP also very strongly supports research and development of pharmaceutical cannabinoids and ongoing research in marijuana and its effect on kids as well. So we definitely support the need to have ongoing research. And again, just summarizing the marijuana timeline in Michigan, again, 2008, we legalized medical marijuana. 2018, there was a Prop 1 proposal which legalized recreational marijuana. And then in 2019, marijuana shops or dispensaries were able to be licensed and open up to sell recreational marijuana. And 2020, recreational sales of marijuana outperformed medical sales of marijuana. So that's certainly not surprising. When I drive from my home in Bluefield to Flint along I-75, I see massive boards advertising marijuana dispensaries. So the Michigan State Department of Licensing and Regulatory Affairs, LARA, is the agency that issues appropriate licenses for anybody who wants to start a recreational marijuana business. So you've got to, they have a tight regulation, and you've got to fill out the paperwork and kind of go through this marijuana regulatory licensing agency before you can grow, sell marijuana. And one of the goals of the regulatory agency is also to tightly regulate sort of what we call edible marijuana products out there. So a lot of my teams are, when I ask about marijuana use, I don't ask, are you smoking any weed, or are you, I now say, are you using any weed? Are you using any marijuana? Because adolescents are both smoking it, vaping it, and eating it, because there are many forms of marijuana available. As you can see from this in the dispensaries, edible forms of marijuana literally look like candy bars, or they look like cookies, or they are like cookies and brownies and cakes. And I mean, they're completely, they look exactly like edible products without, normal edible products. And the problem with this is when this is lying around, what we're seeing is a lot of young kids ingesting these edible marijuana products, thinking it's a cookie or a brownie or chocolate. And many of the young kids are coming into the ED and poison control with marijuana toxicity because they're eating these edibles. So this is really of significant concern. So we have to really regulate this tightly. So just to summarize, where are we in the state of Michigan in terms of legalization marijuana? What does that mean? And what it really means is that adults 21 and up are permitted to possess and consume marijuana, but only up to 2.5 ounces, which is kind of like in a small sandwich Ziploc bag. You can, that sort of is 2.5 ounces of the flower or the leaves of the marijuana plant. And you can have 2.5 ounces of the marijuana on your own possession, or use it in the house, or transport it anywhere. But, and you can keep up to 10 ounces at home, but only 2.5 ounces can be, outside. The other 7.5 ounces of the marijuana, if you have it at home, has to be stored in a locked place or a container, locked container. You can grow up to 12 marijuana plants in the house individually for your own personal use. But obviously beyond that, if you're growing more than that, you need to get proper licensing to be a marijuana farm and growing marijuana plants, and you have to get the licensing through LARA. In terms of driving under the influence of marijuana, so again, there's no current good test to assess for the amount of marijuana a person might have in their system if they're driving, and that's really still a problem. So there's no roadside test for marijuana use, unlike the alcohol one. But in general, the laws in the state of Michigan, and for the most part, all states, they perceive driving under the influence of marijuana the same as driving under the influence of alcohol. So, no drugging and driving, and no drinking and driving. So it's sort of the same application is involved in both alcohol and marijuana use. And again, in the state of Michigan, consumption of marijuana in public is prohibited, just like alcohol is. And then municipalities can certainly choose to ban retail selling of marijuana, or ban, marijuana dispensaries opening up in their area. But you can't ban consumption of marijuana by anybody who's 21 and older. So moving on, now that we've kind of know a little bit about the statistics and the current trends in terms of marijuana use among teens, and that there's a sharp rise in the use of marijuana among teens, we need to really look at the effects of marijuana on the teen brain. So, the teen brain is a complex brain with lots going on in it, not always in the right places when it needs to be. But what is interesting is that we certainly are learning a lot more about adolescent brain development in general. And currently, research has shown that the adolescent brain continues to develop well into the 20s, even though sort of legal adult age is 18. In terms of cognitive and psychosocial and emotional maturation in the brain, that process is really not complete until the mid-20s. So the adolescent period is a very vulnerable period in terms of the impact on brain development. And also it's a period, as we mentioned, of engaging in just sort of risk-taking behaviors, often engaging in, drugs, alcohol, sexuality, without necessarily thinking about the implications of or the consequences of the action of these high-risk behavior. So that also, is tricky when you're working with teens. And therefore, all of these combinations, the fact that the brain is still developing and that adolescent is a period of increased risk-taking, kind of, combines together and can certainly lead to trouble in terms of substance uses in general. And most drugs of abuse in the adolescent period lead to a general blunting of an important neurotransmitter called dopamine. And if you've got decrease in dopamine, that leads to poor outcome overall in the development of the brain. And that's the thing that's really worrisome among adolescent. Marijuana affects the adolescent brain very differently than it does the adult brain. So again, just kind of summarizing a little bit, this slide very nicely shows that as we move from childhood into adolescent into the early 20s, you sort of see that the brain map is becoming more blue, and the blue area implies that there's increase in myelinization, and the gray matter part of the brain is becoming sort of more dense, and that means the neuronal connections between different parts of the brain are becoming a little bit more clear and sort of sharper, and as the brain matures. So there's better communication between different parts of the brain. Generally, the first parts of the brains that develop earlier are kind of our occipital lobe, our temporal lobe, and our parietal lobe, sort of the hind side of the brain, as we call it. The last part of the brain to mature is our frontal lobe, or our prefrontal cortex, as we call it, or in other words, our sort of a higher functioning executive part of the brain. That's the last part of the brain to develop, and that fully doesn't develop and mature until the 20s. And that frontal lobe part of our brain, or a higher functioning part of our brain, is really what regulates our, what we call executive function, our ability to make good decision, judgment, planning, problem solving, all of these sort of executive functions of higher thinking. These are not fully developed until the mid-20s, and it's our frontal lobe that also is very susceptible to use of to marijuana use, and in particularly THC. So again, kind of summarizing what's happening in the teen brain, the teen brain continues to develop into early adulthood. During the adolescent period, there are just better connections happening within these neuronal connections that is really important, such as pruning of inefficient neurons, insulating axons, optimizing the neuronal connections for best future success. And as this pruning and optimizing of the neuronal connection is happening, predominantly in the prefrontal cortex, anything that interferes with this, such as marijuana, can have a negative effect on the adolescent developing brain. So that is a significant worry. So in other words, the prefrontal cortex, which is responsible for higher order cognitive function, is the part of the brain that is highly susceptible to the negative effects of marijuana. So as I tell my patients, their developing brain and the effects of weed on their brain is much more different than the effects of weed on the adult brain. So that's a conversation I have repeatedly with my adolescents to help them understand, despite the fact that marijuana has become legal, and no matter what they hear from sort of the adult world in terms of marijuana use, it affects adolescents' developing brain in a negative manner. And as we're learning more about, plus part of legalization of marijuana is that now we can actually get funding and money to study marijuana use and its effect on the teen brain. So that's a plus part of legalization, that now we can get official funding. So let's go back a little bit and talk about how does marijuana, particularly THC, delta-9 tetrahydrocannabinol, have its effect in the brain. And it's really through what we call the endocannabinoid system. So our own body has its own sort of endocannabinoid system. And this endocannabinoid system has receptors. I know this is sort of a very busy slide, so I just kind of put it up there to show a picture, but our own body has endocannabinoid system, and this system has receptors that are called cannabinoid receptors, or CB1 and CB2. And normally these receptors are activated by a chemical that our own body produces called anandamide. And this chemical, very much our body's own endocannabinoid chemical, very much looks like THC. So most of these endocannabinoid receptors, CB1 and CB2, are found in the brain. CB1 is found mostly in the brain, and CB2 receptors are found mostly in immune cells in the GI tract and in the spleen. So going back to the fact that our brain has its own natural endocannabinoid chemical called anandamide, as is here. Anandamide looks very similar to THC. So THC, delta-9 tetrahydrocannabinol, the active ingredient in marijuana, If you are using marijuana, it attaches to the cannabinoid receptors in the brain or the gut and displaces the normal anandamide chemical that should be part of our brain. And instead, the THC sort of takes over because they're very similar in structure. And what this results is that normally, if we did not use marijuana, the body's endocannabinoid system would produce this anandamide. This would attach to the CBD receptors. And this endocannabinoid system is very important in normal brain growth, regulation of normal neurotransmitters, and very much important in the functioning of our executive skills, memory, reward processing. So that's sort of the normal brain neurochemical process that should be happening. If we're using marijuana, the THC then displaces the anandamide and instead attaches to the CBD receptors in the brain and, as I said, in the GI and immune system, and instead produces or interferes with the normal brain neurochemistry and can lead to negative effects in the developing brain. So what are some of the long-term negative effects of marijuana on the brain? And again, just this slide, it's busy, but basically it says that there are these cannabinoid receptors in every single aspect of our brain. And when we're using marijuana, THC, it attaches to literally all these receptors found all over our brain. So therefore, marijuana's greatest effect is its effect in the brain, its psychological effect, because of this huge abundance of CB1 receptors. And a lot of studies are showing that there are long-term negative effects of marijuana on the teen developing brain. And some of the acute effects of the use of marijuana among teens is that it increases heart rate. There's the initial effect, because it's a psychological effect, you get an initial euphoria, relaxation, change in pain sensation, distorted sensory perception, distortion of thought and time, slowed reaction to stimuli. These are sort of the acute effects of marijuana use. Chronic or more detrimental effects is memory impairment, excessive vomiting, hallucinations that could lead to paranoia, anxiety, and psychosis. And we'll talk about that a little bit, because that's definitely what we're seeing more of, particularly related to the fact that there's increase in potency of THC in the marijuana species. Therefore, people are having a lot more potent negative side effects, such as hallucinations, paranoia, psychosis, and excessive vomiting, or what we call cannabinoid hyperemesis syndrome, or cyclic vomiting. And I'll talk about that a little later. But as I mentioned, there was a really good article recently published in Pediatric and Review Journal in February 2021, which summarized marijuana use and the potential implications. So this slide is from that particular article. And again, it talks about the effects of short-term use of marijuana that we talked about, and then the negative effects of long-term use of marijuana, particularly in terms of impairing cognitive function, decreasing IQ, decreasing academic ability, and then increasing the risk of in people who might already be disposed to depression and anxiety. If you use marijuana and continuously use marijuana, you're going to have an increased risk of bringing on sort of anxiety episodes or increase in depression as well with chronic use of marijuana. Certainly, I'm also seeing a lot more kids coming in with acute paranoia, hallucinations, and these kids are coming into the emergency room, and that is often associated with using much more potent forms of marijuana, such as what we call dabbing. Dabbing is like a concentrated wax form of marijuana oil that they smoke and inhale, and that concentrated wax form of marijuana has about 80% THC in it. So it's highly potent, leading to a lot of these serious psychological conditions such as paranoia, psychosis, severe panic attacks. And I've seen several of those kids in my practice. And this slide also sort of nicely summarized the fact that as we are seeing increase in use of marijuana, we are definitely seeing 4 to 7 times, these kids are more than 4 to 7 times more likely to develop what we call cannabinoid or cannabis use disorder. So that can occur, into adulthood with increasing chronic use of marijuana. And the symptom of cannabis use disorder limits and impairs functioning in terms of daily life, You have increased tolerance and therefore increased craving for cannabis, as you do with addiction to any other substance. And then when you stop marijuana use, you can get some withdrawal symptoms such as sleepiness, nervousness, anger, depression, agitation. And I am also seeing that among my adolescents who are choosing to sort of cut back on their marijuana. They tell me that they feel angry and nervous and agitated as well. So we're definitely seeing cannabis disorder symptoms as described in the DSM-4 diagnostic manual as well. So, those of us working with kids with marijuana, we kind of need to understand the lingo out there. What is dabbing? What's a bong bean? What is G-pen? What's a hookah? So I'm going to kind of quickly go through the different forms of use of marijuana and some of this terminology. So classically, marijuana was smoked as a joint or a blunt. A joint is just marijuana leaves and flowers that were rolled in cigarette paper and they smoked it. A blunt is, leaves and plant of marijuana that was rolled in tobacco tobacco leaf and they smoked it. So by smoking marijuana or any form of inhalation, the marijuana goes right into the lungs. And because you're smoking it, again, there's the same negative effects on our lung as would be with cigarette smoking, damages the respiratory system. The blunts have nicotine in them. There are also, other toxins in terms of using tobacco leaves and paper that also can cause toxins in the lung. And then vaping cannabis is definitely not a safe alternative. As I said, we're definitely seeing increase in vaping of marijuana, and that in itself has its own issues. But anything that is inhaled into the lungs, whether you smoke it or you vape it, the effect is very quick. In 5 to 10 seconds, you kind of feel the effect and get a high, and the high can last for about 30 minutes to several hours. So it's very immediate effect there. And in the vaporizers, the e-cigarettes, as I mentioned, what it is the THC oil or liquid is in these e-cigarettes, and then that's what's inhaled. And again, the concentration of the THC liquid can be very potent, and the concentration varies, and that is what's becoming highly worrisome. That's one of the reasons maybe why we're also seeing so many negative effects of marijuana among the adolescents and young adults because of the increase in potency of THC. So other things are pipes and bongs. Again, you might have heard of this. Pipe is you're going to be smoking the cannabis flower, just like a regular pipe. Instead of tobacco, it's going to be cannabis in there. Bong is where the cannabis flower is burned and its smoke is cooled through sort of a water system, and then it's inhaled. So again, these are all still inhaled, and the effect is very quickly felt within 10 seconds and lasts for about 30 minutes or so. As I mentioned, another inhalation form is what the kids call dabbing. So dabbing is concentrated THC wax that is heated and then aerosoled and then inhaled. So again, the effect is really quick, but the problem with dabbing is that this concentrated wax form of THC of marijuana has 80% THC in it, huge amount of THC. So can definitely cause a lot of negative effects. And that's, as I mentioned, quite worrisome. The new sort of line of marijuana, especially in recreational legalization of marijuana, is this whole edible field of cannabis. So, the marijuana THC is extracted as an oil from the flower and plant and then injected into different kinds of foods, into drinks, and then these are consumed. So this is becoming sort of a hot new way to try marijuana. It's eaten, so this particular marijuana form is metabolized through a GI tract, and therefore the effect is much later. It takes about 20 minutes up to maybe an hour or two to really feel the effects of marijuana, and the high can last for hours. And again, the THC concentration varies greatly depending on what it is that's injected into these different edible products. The problem with edible products is because you don't feel the high right away, people just keep consuming more and more, and therefore can really lead to toxicity because overconsumption can easily happen since they're not sort of feeling the effects of the marijuana very quickly as compared to smoking it. Then there's also different kinds of sprays, tinctures, and capsules of marijuana. High in THC concentration. There's also these different oils and tinctures that have got sometimes they've got combination of CBD, the other active ingredient in the cannabis plant, the cannabinoid, and as well as THC. So there's different ratios of THC and CBD in these oils and bottles, and available in all kinds of different concentrations. So these products are also out there. I also want to just talk about, we had briefly mentioned that the other sort of negative effect that I'm seeing of marijuana, and huge amount in the past year or two, and I literally was just talking to one of my colleagues yesterday, is that we're seeing adolescents and young adults come in with what we call this cannabinoid hyperemesis syndrome. And I don't know if any of you have seen it or heard about it, but we are definitely seeing that. And it's really a presentation of what we call recurrent cyclic vomiting. So these adolescents and young adults come in with recurrent cyclic vomiting, severe nausea, severe abdominal pain, and they've had a multi-million-dollar workup, and nothing is, everything's been normal in terms of their tests to try and figure out why they're having this cyclic vomiting. And in the adult literature in the beginning, we were seeing this sort of recurrent cyclic vomiting, nausea, and abdominal pain with a negative workup in people who were chronic marijuana users. So there was now a new sort of coined term for this cyclic vomiting called cannabinoid hyperemesis syndrome. There's association and link between cyclic vomiting and chronic marijuana use, leading to this new syndrome called cannabinoid hyperemesis syndrome. And as I said, now with increasing use of marijuana among all ages, including adolescents and young adults, we are definitely seeing adolescents and young adults now coming in with cannabinoid hyperemesis syndrome. So again, they come in with recurrent nausea, cyclic vomiting, multiple ED visits with cyclic vomiting, severe abdominal pain, and we find that the urine is positive for THC, or they admit to marijuana use. And so now we're also diagnosing adolescents and young adults with this cannabinoid hyperemesis syndrome. We published, myself and my colleagues in Clinical Pediatrics in 2016, published 3 case reports of cannabinoid hyperemesis syndrome in the pediatric population in adolescents, because initially it was diagnosed in the adult world, and now we're definitely seeing it in the adolescent and the young adult world. And I truly have to say, I'm seeing in the past year and a half to 2 years, I've seen a huge increase in cannabinoid hyperemesis syndrome among my adolescents and young adults in my practice. Definitely marijuana use has increased during the last year pandemic and lockdown, as has other substance abuses. So that's probably the reason why we're seeing increase in this particular cannabinoid hyperemesis syndrome as well. So I apologize, I'm talking quite fast, a lot of material to cover. But I do want to, going back again, because of increasing trends showing that marijuana use is on the rise, the AAP recommends that all of us as pediatricians screen all adolescents for substance use, and they've got a wonderful tool and that is on the AAP website to assess substance use, do maybe a brief intervention in your office, and maybe then make a referral for treatment if there is significant substance use and that adolescent needs further mental health and substance use expertise help. Through this sort of program called C-Bright. So C-Bright is sort of the AAP has this sort of algorithm that helps us to use this in our office to assess for substance use and maybe do a brief intervention if appropriate among our teens and counsel them or refer them out. So I highly recommend you can get the C-Bright algorithm and how to use this tool on the AAP website. It's a great screening tool. I also recommend, the AAP also recommends screening all adolescents for tobacco, alcohol, and other drugs of use with another formal validated screening tool called the CRAFT screening tool. Many of you, again, may be familiar with it. The CRAFT screening tool, again, should be, just like often now we're using what's called a PHQ-9 as part of our depression and anxiety screening tool when adolescents come in for their annual visit, complete physical, or if there's any concerns. They also recommend using this CRAFT screening tool to assess for substance use. So, and I'll kind of talk about that a little bit in the next slide. So the CRAFT, and again, as I said, many of you may be familiar with this CRAFT screening tool. So The craft screening tool is kind of a series of questions, and it begins with, I just want to sort of backtrain a bit and add a caveat that when I'm doing substance use history and asking my adolescents about substance use, I really do it confidentially without the parent or their legal guardian in the room, because and same as I do with my sexual history, my history of substance use, because if we're going to ask adolescents, if we don't take this history confidentially without their parent in the room or legal guardian in the room, then we're really actually not going to get a truthful answer, because the adolescent is going to tell us the truth if their parent or legal guardian is sitting in the room. So it's super important to keep in mind that these screening tools and the specific questions, and even the Seabright tool or the CRAFTS tool, we need to do it without the parent in the room in a confidential manner, and let the team know that we're going to be talking to them and discuss what I call confidentiality with the adolescents first before we start asking these questions. So once we've got the parent out of the room, and if I'm using the craft screening tool to assess for substance use, I start off with saying, I'm just going to ask you a few questions. I ask all my adolescents these questions, again, just to make sure that they understand I'm not particularly singling them out. And it's important for me to ask you these questions so I can get to know you, help you, and help you stay well and safe. And a lot of what we talk about is confidential. I'm not going to necessarily discuss everything with your parent. Of course, if there's something serious going on, if a kid is really going down the road of substance abuse and having difficulties, we absolutely have to break confidentiality and involve the parents. So I do tell them that. I say that, a lot of what we talk about is between you and I. I'm not going to tell everything that I talk about to your parent, but if there's something serious going on, and I think that your parent needs to know about it, then I will let you know that we have to discuss this with your parent, because obviously there are times we definitely have to break confidentiality for the safety and well-being of the adolescent. So that's kind of like my upfront line with the adolescents before I ask them questions about the craft screening tool. So once I've told them that, the first part of the craft tool is I just say, in the past 1 year, have you used any, I go down specifically each individual substance. For example, have you used any alcohol, beer, wine, I'm specific about it. Have you smoked anything, cigarettes, vaped, e-cigarettes? Yes, no. Have you used any marijuana? So as I said, I used to say, have you smoked any marijuana? Now I've changed and I say, have you used any marijuana? Have you used any weed? Yes, no. So depending on their answer, if they say no, that's fantastic. Then the question I might just follow up with that in those kids who say no, they haven't used alcohol or marijuana, is still say, hey, you know what? Have you ever been in the car with anybody if the driver's been drinking or using marijuana? So we want to actually counsel and talk to them about themselves not drinking and drugging and driving, but also not getting into a car if any of their friends have been drinking or drugging and driving. So we do want to counsel them about that. And then if they say yes to any of the alcohol, marijuana use, then I'm going to go down this route here and ask them more specifics than if they said to marijuana use. Have you ever ridden in a car driven by somebody who's been high? Or have you ever been high, both alcohol or marijuana use, and driven a car? Have you ever used alcohol or marijuana to help you relax and feel better about yourself? I would say when I ask that question with my kids using marijuana, they all tell me they use marijuana to help them sleep or to help them relax or de-stress. So that's a tough one. Then going on further and asking these specific questions if they've used marijuana by themselves, alone, because these are all worrisome factors if they're answering yes to this, if they've ever used marijuana and now they're forgetting things, and if either of their friends or family have noticed that they're using too much weed, too much marijuana, and that they should cut down, that's definitely a problem, and that adolescent is going down the road of sort of more abuse versus use. And have they gotten into trouble, whether it's school or the law, with respect to using marijuana? So again, if any of these are yes, that indicates and tells us that that kid is really going down the road of substance abuse. And if there's a lot of yes to this, I'm definitely going to have to break confidentiality and involve their parent or their legal guardian because this kid needs more help than just, and they're beyond sort of what we call normal adolescent experimentation of drugs and alcohol. So, but if I'm going to break confidentiality and have that conversation with the parent, I always do it in front of the teen. We do it together because I don't really want to lose the trust of my teen. I definitely want to get this kid some help. I definitely want to, engage the parent in the conversation as well, and have and open the dialogue between substance use between the parent and the teen if it hasn't already been opened, before. So we want to always encourage communication between our teens and our parents, even if we're sort of doing a history initially ourselves as healthcare providers, confidentially, because that's really the only way you'll get sort of a truthful answer. Okay. And then, this is another sort of an interesting survey. This Committee on Substance Use came out with this sort of abstinence challenge. Sometimes, we use these sort of contracts and things like that you can kind of make a deal with a kid. And that would be somebody who's sort of going a little bit beyond normal experimentation with marijuana use among teens, and maybe sort of using it a little bit more, but not enough that they're really kind of going down the road of substance abuse. It may not have impacted their life negatively so early on, but we certainly don't want them to go down the road of continuous substance use. So I might make a contract with my adolescents in terms of, hey, let's and it could be a written contract, it could be a verbal contract, or I often sort of shake hands with my teens after they've made a commitment to stop using marijuana, and kind of do a little bit of what we call motivational interviewing assessment to help them move down the road of making better choices. This is also another wonderful poster that you could put up in your office through the CDC public health campaign, again, talking and making sure that everybody understands that marijuana is still a drug. Even though it's legal, it's still a drug. And that marijuana and driving don't mix, just like alcohol and driving don't mix. Drug driving is, not, it's treated by the law the same as drinking and driving. It's an illicit substance, so make it very clear that using marijuana absolutely negatively impacts your driving ability. And it's really important for our young kids to understand that, because again, as I said, a lot of times they're getting a lot of mixed messages out there with marijuana use from either the adults in the community who may be using marijuana and yet not understanding that their brain is different than the adult brain. And no matter what they hear, marijuana is still a drug, and it has negative effects in the brain, and can be addictive. And having those conversations with the teen and helping them understand that is very important. So on that note, I think I'm going to be ready to, I have ended my talk. These are just a list of different references and websites. And as I said, the most recent article was the article published in Pediatric and Review Journal in February 2020, which very nicely summarized marijuana use among adolescents. And just recently, the April issue published, or actually I think it was the June issue, published an article on cannabinoid hyperemesis syndrome in the pediatric world. So because we're definitely seeing a lot more of that. So on that note, I am going to end my talk and thank you all very much. So I don't know if we have time for questions.
Yeah, we have just one here in the chat so far. So the question is, do you have any recommendations for specific treatment models for treating adolescent marijuana users?
Yes, excellent question. So I'm not quite sure what they meant by treatment. Is they asking that is this somebody who already is abusing marijuana? Is it kind of in that diagnosis of cannabis use disorder, as we call it? If they are, then definitely, in terms of treatment, that is not my area of expertise. I would certainly be referring that patient and to substance use experts, in the community. So in terms of acute sort of cannabis effects, marijuana effects, these kids coming into the ED who are paranoid, who have sort of psychotic episodes because they've used a lot of marijuana product that's very high concentration THC, and they come in with the acute episodes. We do treat them in the ED, which as we would with often other drugs, in giving them Haldol and IV hydration and sort of just treating their symptoms of anxiety and panic attacks. So I'm not sure if I've answered it 100%. I'm not sure if I answered the question, but hopefully.
All right, and then we just had one more question, and that person was asking if we could make the PowerPoint slides available. So if you're fine with that, we can go ahead and get those emailed out to the participants. People are specifically interested in those references at the end there as well.
Absolutely, yes, I think we've got that, yes.
Okay, so we will use whatever email you registered with, and that is how we will distribute that to you in the next day or so, all right? So I just want to thank you, Dr. Swany, for your time and information today, and thank you to all of our attendees for joining us this evening. Today's presentation is one of many webinars scheduled throughout the month of September. You can still register for any upcoming presentations at sccmh.org. At the conclusion of this session, a pop-up will appear on your screen with a survey. Please take a moment and fill this out and give us your feedback, especially those of you who registered to receive continuing education credits, as this is a requirement. Thanks again for joining us today, and we look forward to seeing you all at our next webinar.